How are you?
Good.
I have a question for you. So, where are you going to get healthcare from after you graduate? Do you know where you're getting healthcare from after you graduate?
Nope.
No idea.
It's a worry, definitely.
I'm not sure.
I don't have any idea right now.
I have no idea.
Or I can just find a boyfriend who cares about me so much.
Do you know what the chances are of getting that?
Of getting a job that covers me?
Yeah, that specifically covers you, yeah.
Oh, jeez. Well, I actually know Starbucks does.
My dad actually did bring it up this summer. So he was basically saying, like, we need to get pretty decent jobs that give us good health care, or, you know, we're pretty much going to be paying out of pocket.
I graduated college a year ago, well, a year and a half, I guess, and I lived in Spain for the whole last year, and I was teaching English. Yeah, I was actually without health care for the summer after graduation. I went to Spain and I was covered because, of course, Spain has universal health care. So I've had about 6 months of uncovered time. And total, and in that time I only had one incident, which was only 2 weeks before my health insurance was going to start. I actually had salmon for dinner with some family friends and got a bone stuck in my throat, so I ended up going to the ER, and I basically waited for 4 hours, went in, spoke to a doctor, had my blood pressure taken. They said, oh, it's a salmon bone? That won't be a problem, it'll just disintegrate. And I said, oh. Okay, almost $1,000 for 4 hours of sitting and about 5 minutes of talking to a doctor.
And they didn't really even do anything.
They literally only took my blood pressure. I've been having a problem recently where I've had migraines every day for about 2 weeks. I was prescribed medication to help me with these migraines. And I was like, great. And the pharmacist came back and was like, you're not covered, so you have to pay out of pocket. And the medicine was over $300. Given that I just paid an ER bill, I don't have $300 for medicine, so I didn't get it. Not what I expected, knowing that my job was going to cover my insurance. Either. I mean, I was like, great, I'm employed, I have insurance. Not. I mean, talking with my parents, and they were like, you know what, like, just relax. This is why we have Obama working towards healthcare.
Right now, in Washington, there's a consensus among both parties that the healthcare system is broken. Only 53% of young adults, 18 to 29, get some form of health coverage through their employer. The rest of us are simply left out to dry. And even if you get health coverage, there's no guarantee it'll be comprehensive. There's no guarantee it'll be any good. We are often just one accident away from bankruptcy. And these bills going through Congress, they should be our bills. We should be their champions. One of the central goals, if not the central goal, of health reform is to make insurance affordable. The public option would essentially be insurance run by the government. You could get it if you want to, but you wouldn't have to. There are 2 reasons public option is a good idea. First, it wouldn't have to worry about advertising, and it would be non-profit, so it wouldn't have to worry about executive salaries or big bonuses or any of that stuff. So that would cut out a lot of fat in the system and save quite a bit of money. But you wouldn't have to be enrolled in the public option for it to benefit you. It would also put competition into our insurance industry. The Democratic proposals would give 97% of Americans coverage.
I sing a song for my brother as he waits to cross the wire, wondering what will be on the golden side. I'm sure that much will change, but what matters now will stay the same for a while. For a while. For a while. For a while. I sing a song for September. Even summer has to end, but the autumn brings me home again. I expect the leaves to change.
Yes, I'd like to leave a message with Senator Feinstein, please.